We've invited dermatologist Dr. Tess Mauricio to help Diamante here figure out how to treat her acne.
Diamante, you are not alone.
Good.
And acne is not just for kids in puberty. I mean,
17 million people in the U.S. suffer from acne of all ages, and I've had acne my whole life. Hormones definitely play a huge role, which is why it's worst around puberty.
We all have pores on our skin. At the base of those pores, we have sebaceous glands. Those glands secrete sebum, and that sebum is meant to come up through the pore to lubricate the skin and the hair. But if it gets clogged and is not able to come out either from the sebum or from dry skin, we get that so-called zit that gets inflamed underneath the skin, whiteheads, blackheads,
and
gets
pimples. Embarrassing, like Diamante said. So I'm going to first take a look at your skin. We're going to have the expert take a look here. That's right. And so you have a pimple right there on your nose, right? And here, and a few whiteheads and blackheads. And so I'm actually going to have you guess, because there are different types of acne. Go take a look and see which type of acne you think you have.
Well, I think I've been on 5 at one point, but right now I'm probably 2.
2 is actually a whitehead, and you definitely have that. But because of these red, what we call inflammatory papules, more inflamed acne lesions, you're actually a 3. But you're right, some patients really go through different.
Though,
yeah,
you'll be okay.
There are worse stages. So, but there's definitely a lot of things that we can do to help. And for over-the-counter products, there are 2 main ingredients that you would see. And the first one is salicylic acid. This is our giant pore model. And you have that bluish sebum, which is the oil. And with puberty, we create more oil, and that creates the problem. And then if you look inside, actually, you'll see the little balls. That's bacteria, and they're all in there.
That.
Right. And so then this nylon is sort of a model of the top layer of the skin that ends up creating the plug. So salicylic acid breaks down the keratin, which keeps those skin cells together. So basically ungluing them and allowing them to have the unclogging the pore. And so that's really, really important in treating the kind of acne that you have, because you have those blackheads and whiteheads. Yeah. And then the other big ingredient that you see both in over-the-counter products and also prescription products, which we'll talk about later, is benzoyl peroxide. Benzoyl peroxide kills the bacteria down the pore. So those little green balls there, we're going to try to get into that. And this is the model of benzoyl peroxide. And you can just kind of imagine it's going in there, it's shrinking the sebum, it's getting the bacteria, and when there's less bacteria, there's less inflammation, and there's less redness, and you actually heal. The only thing about benzoyl peroxide is you have to be careful, because you can actually get irritated.
But how do we know which products will make our skin shiny, or if they're going to make them flake or irritated?
If you're finding that the over-the-counter products are not addressing your problem, you have to start seeing a dermatologist. You have to come to see me, because there's a lot more we can offer as far as, prescription acne treatments. There's oral antibiotics, so pills that you actually take that help kill the bacteria. There's isotretinoin, which is a systemic retinoid. There's birth control pills for adult women, because hormones is a big problem. And I've done a few of these here. Light and lasers can help both acne and the scars. And to get that dirt completely out of the pore, we have the great Clarisonic cleaning system that actually vibrates that dirt out of there.
And Diamante, you're going to go home with one of those Clarisonic products.
Wow. Thank you.
And puberty isn't forever.
No.
You'll get through it.
Yeah.